don't know, Prevent Child Abuse America is celebrating our 50th anniversary, our 50th year this year, and the 30th anniversary of our Healthy Families America home visitation program. And in this time of sort of celebration, thinking back on, our strong foundations, our strong partnerships, our really strong, tremendous efforts to help prevent child abuse and neglect before it occurs, it's not just about reflection, but it's about this new vision. What are the next 50 years going to look like? And although we have a lot of smart people with interesting experiences and backgrounds among us at the national office, we know that prevention can only happen in partnership, which is why we're being really intentional to be inclusive of voices from our networks, from our board members, from our partners, from children and families in the communities that we all live and work alongside. We're just so thankful and really understanding that we need a deeper engagement of families and of partners and of lived expertise, all kinds of expertise. We need to get out of our silos and be intentional about really transforming what the next generation of prevention looks like in our country and for our children and families. And so I'm just really, really thankful that you all are here. You all have been participating in many ways as we try to think about what is our North Star? What are the impacts that we're trying to achieve together? And how are we going to get there? What is our theory of change? And so this kind of zooming out process, and again, today, the inaugural session of our Zooming Out speaker series is really a way of stepping back and listening with humility and with focus on why race equity has to be at the center of this process. It can't just be a part of or a check mark, or, it's really the lens through which all of the work that each and every one of you do really lives, right? So I'm just really, again, super thankful that you're all with us today. We are recording this so that we can share it with partners and others who aren't able to attend live. But without any further ado, I just want to first say how thankful I am to introduce my colleague and friend, Dr. Renee Branch Canady, to be our speaker to get us kicked off here. First of all, when we were all brainstorming on what we wanted this session to focus on and what are the themes that we want to talk about and what is a public health approach and how does that necessarily intersect with race equity? How does it intersect with creating the conditions that we're all trying to create to be really transformational in the next generation? Of course, Dr. Canady was at the top of my list. I've known her for many years. We were just saying how it's out of context because certainly I met her years ago when I was at the Centers for Disease Control and Prevention. And really, it was through a session she helped shepherd us through, many scientists and staff, to really have kind of an experiential understanding of the many domains of privilege that impact us professionally, personally. It was really a transformational 3 days, I think, that we were together. And just, it was such needed for me at that time in my professional and personal career to really see that this is the right course. We do need to be intentional. We do need to be inclusive, and we do need to do better for children and families in the future. And so I'm just so thankful that Dr. Canady is with us. She is the CEO of the Michigan Public Health Institute, a Michigan-based but nationally engaged nonprofit public health institute dedicated to advancing public health through public health innovation and collaboration. Certainly being a CEO of any public health organization during the last 3 years. It has been a lot. It has been a lot for all of us. And I know that Dr. Canady is going to share a lot of her expertise and just learnings with humility, but with honesty and with integrity to challenge us to understand what is it that's working really well? What are the things we have to continue doing? And what are the things that really we need to refocus or recharge or innovate? I'm just really excited that she has such a perspective on moving away from just program thinking to really big systems level thinking, right? Again, those conditions that we need to really be able to implement a public health approach, right? A public health, again, is what we all do collectively to assure the conditions in which all people can be healthy and thrive and be prosperous. And that, I know, is the vision we're all looking to achieve. So she'll really help us better understand what's needed in communities, in our network, and at a national level. And we're just really humbled to have her here today. Really quickly, before she starts, I just want to let you know, after her remarks, Susan Dreyfus, who has been helping us here at the national office to really facilitate this adaptive strategic planning process, she will then facilitate sort of a moderated discussion at the end of this. So I hope that you all, I know you're here, but I hope that you can fully be here, at least for the next hour or so, to hear and learn and jot down your ideas, and we'll have time to talk through some of them. So without further ado, Dr. Canady, welcome, and thank you so much for being here.
I am absolutely thrilled to be here, and thank you, Dr. Merrick, and thank you to all who have been so kind, Jennifer and Kirsten and Susan and all of you that just got me ready for what I've been calling a little family meeting. If you're here, it's because I believe it's because you're invested in this topic. And I don't presume to tell you what you do, talk to you about what you do. But what I want to offer is a little bit of deeper thinking about why you do what you do and how you do what you do. So I'm going to throw down a gauntlet, and hopefully you'll grab it up before the end of this conversation. So we'll talk for about 30-ish minutes and then open it up for a little bit more of question and dialogue. So bear with me as I share my slides. All righty. Is that, Melissa, can you give me a thumbs up? Is that looking right? Okay. I really appreciate you. First of all, I'm thrilled to be the inaugural speaker of the Zooming Out series. I love that title. And I appreciate the title that you all have offered and asked me to speak on, this issue of addressing systemic racism and poverty. My subtitle is Equity and Justice as the Journey to Transform Child Welfare. And so, like I said, we will just kind of walk through this. I love quotes. I'm going to start and end with a quote. And let me just offer this one to you from Dr. Martin Luther King. And he says, "I have the audacity to believe that peoples everywhere can have 3 meals a day for their bodies, education and culture for their minds, dignity, equality, and freedom for their spirits." That word freedom took on new meaning as I read this quote, having looked at your theory of change and thinking about what is freedom. And I also just love that Dr. King says, you know, I have the nerve, the audacity to believe that, in these United States, kids don't have to go to bed hungry. Kids don't have to worry about their schooling and the quality of their schooling and their emotional, mental health and well-being, their freedom and their equality, their spirit, as well as their mental and physical health. And I agree with him. I just have the audacity to believe the same. The challenge has been things are kind of dark these days, not just with COVID. COVID has darkened things, but you all know the expanse of work that you're dealing with, the complication of circumstances that families are grappling with. But as a person of hope, Francis Bacon says, in order for the light to shine so brightly, the darkness has to be present. So I believe that our best days are ahead of us. And as I think about how wicked these problems are and how they seem just impossible, right? How on earth can we address these? I think about the work of Howard Koh, who is a former assistant secretary of HHS, is now a professor at Harvard University. And he said that public health problems pose special challenges And I would offer that human services problems, because as Melissa said, it is all under this context of well-being, right? And assuring those conditions for people to be their best self, that there are these really important challenges that we want to shine the light on. One is that public health and human services problems stem from numerous and highly complex causes. It is complicated. And we are sort of running around looking for the silver bullet. Like, tell me the thing to do, Dr. Canady, and we'll just go do it. But it's complicated. The solutions are well, I'll say they're complex.
I mean,
not
I
necessarily
don't know.
complicated.
In some cases,
We can do them. The other is Dr. Coe said that these things play out in the public. I know in Michigan, when I was a local health officer, we had this huge controversy because a child was killed in foster care at the hands of his foster parents. And it was all in the media. And my bosses, the commissioners, were challenged, and our state Health and Human Services director was challenged, and nobody wants bad news, right? These problems also impact a lot of different stakeholders. And so the solutions can't be one size fits all. Howard Cole also says that these things take unusually long-term solutions. In other words, in my mind, they're not going to happen in the lifespan of a 2-year grant. We've got to get funders and funding sources to recognize that as we think about how we transform the outcomes that families are depending on us. And lastly, these are huge, enormous in scale. But there was a time when I would buy into this narrative that, oh, deconstructing racism is not going to happen in my lifetime. Well, I've now changed my mind on that. This is absolutely generational work, but there are changes that have to happen in my lifetime, in your lifetime, for the generations to see the change. And so I want to talk to you a little bit about you and your lens, right? I want us to think about, if we are going to pick up this gauntlet of being equity leaders that are change agents, that are moving beyond status quo, then what does change look like? What does it sound like? And what does it act like? So what do we need to be, how do we need to be seeing differently? How do we need to be saying things differently? And what do we need to be doing differently? So everybody's talking about an equity lens, an anti-racist lens. What does that mean? If we have this lens, what are we looking at? And I'm going to invite you guys to join me for a second and throw in some comments in the chat. So a few years back, I was on the board of the American Red Cross in our community. And in the summer, as the Red Cross would do, we were pushing this campaign for pool safety. Be cool, follow the rules. I want you to look at this. I want you to see this poster differently. And what do you see? Seems very straightforward, seems like something that we would all want to do, but there is a pattern, a really problematic pattern in this poster. And does anybody see what that is? See differently with me. And just throw it in the chat if you see. Yeah. Yep, who's being pointed at? And yes, the Black kids are the ones that are not the cool kids. The problem people are the brown and the Black kids. Right. Now, did somebody go into a conference room and say, okay, let's design this poster? Oh, wait, don't forget to make sure all the bad behaviors are focusing on the Black kids and all the good behaviors are focusing on the white kids. Absolutely not. You cannot convince me that that ever happened. But that was the outcome. And the Red Cross, to their credit, pulled down the campaign, did some tweaking, reintroduced it. Unfortunately, or fortunately, depending on your perspective, they didn't pull it down before I was able to screenshot and use it for an important teaching message. So what are we seeing? Somebody put this together and did not even see that pattern. So what then? Let's do one more, seeing differently. I want you to look at this image. This is an actual thing. It's not like a Rorschach spot. It's not open to interpretation. It is a thing. Take a few seconds here and look at it and throw it into the chat. What do you see? What is this image? I bet some of you are doing this. I don't see it. I don't see a thing. Come on. Got one image in there. What else? What other thoughts of what this is? Guesses. Mm-hmm. Yeah. Actually, and I don't know whether Olivia, whether you saw this before, but this image is actually a cow. What? I don't see a cow. I don't know. Can you guys see my cursor if I'm moving it around? So I'm going to try to point out these images. Like on the far left corner, the big blob is actually an ear. Okay, super. You can see my cursor. And then the ear follows down to an eye that goes along the bridge of the nose of the cow. Here's a big nostril. Here's the big nostril. This side of the profile is a little less distinguished, but here's the eye, another ear. I hope you're all going, oh, yeah. Wow, right. I love Carrie's comment. Oh, wow. How did I not see that? Can I tell you that racism in many spaces, systemic oppression is very much like this? Now, I will say that I'm going to bounce back for a second. If you ever see this image again, you're going to know, like Olivia did off the bat, it's a cow. Of course it's a cow. That's how racism is. When we train our eyes to see differently, to discern differently, then we see it. And when we see it, then we can do something about it. And we started thinking in our work, in our project we call Adjust, which is advancing justice together. And as Dr. Meyer said, it's a 3-day workshop where we come in and do 2 days with the team, and then we go away for a couple of weeks and let you use your new lenses, and then we come back and sort of then begin to talk about how do you transform your work given the things that you've seen. So what is it? Why is it that we did not all immediately see that cow? What are the things that keep us from seeing, privilege and oppression, keep us from seeing it? And here are just a few things for you to think about. I mean, first of all, there's like this no awareness that people are actually oppressed. No awareness that you're not oppressed. And I would submit that if you're on this Zoom call, you are a person of privilege. You have different types of privilege. You might have gender privilege as a man. You might have racial privilege if you're white. You might have religious privilege if you are a Christian. There's lots of different types of privilege and oppression. Another thing, oftentimes we see from D'Angelo's work on white fragility, she talks about guilt or shame, that this issue of just feeling guilty or feeling ashamed keeps us from seeing privilege, or fear of being cast as the oppressor. Nobody wants to be called racist. There are also laws and policies that convince us that equality is a thing. Well, no, everybody can go to the same restaurant, and that was back in the day. Nope. So we get lulled into this sense of acceptance that equality does exist, even though the facts and the information around us contradicts that. We have this now culture of politeness where we just don't want to talk about it. Don't talk about money, religion, and taxes. This also now, don't talk about racism. But we have to engage. And then media reinforces lots of stereotypes that keep us, again, from seeing privilege and oppression. So we've got to bring some intentionality to this. And we are the ones responsible, because Stephen Covey says we see the world not as it is, but as we are, or as we are conditioned to see it. When we open our mouths to describe what we see, we are in effect describing ourselves, our perceptions, our paradigms, our worldviews, our mental models. So today I want to offer to you a different mental model. So that's seeing differently. Let's talk now about saying differently. We believe, and we use in our workshops, and I use in almost all of my work, facilitated dialogue as a methodology for change. So sometimes people say, I'm just so tired of talking about this. And we say, super, then let's move into having a facilitated dialogue that's going to advance change. And people will often say, well, I don't talk about this because I just don't know what to say. Equity leadership is really more distinctly not about having all the answers. It's about asking the right questions. And so we're going to chat a little bit about that. First of all, you've got to work on building a shared vocabulary in your team. If you Google these words, you're going to find a billion definitions, and you'll be saying equity and meaning one thing, and your colleagues will be saying equity and meaning something completely different. You'll be saying anti-racism, they'll be hearing something completely different. So we actually constructed these definitions in a consensus process to say, what are we meaning? Is this what we're meaning, and why? This definition of health inequity is absolutely one of my favorites. Margaret Whitehead says that health inequity are these differences in population health status and mortality rates, or disproportionate share of children in foster care, or whatever metric you want to put there. But they are systemic, they are patterned, they are unfair, they are unjust, and they are actionable. I can't fix poverty. Of course you can fix poverty. Most people are living in poverty because of rules, policies, regulations. They're changeable, and they're not just the result of some random occurrence or the fault of the people who become ill, the fault of the families whose children end up needing additional care and services. So I love that Margaret Whitehead did two things. One, she called us to action, and two, she invited values to the table. She was looking at data and findings and saying, you know what, this is unfair and it's unjust. These are values. This is our theory of change. We believe that this is wrong, dare I say. And so it pushes you to a different space of action. Health equity, on the other hand, the goal, right, our North Star, is that we will end up with some fair and just distribution of the social resources, that ensuring that everyone has the chance to be their best self, as healthy as possible. People want to just focus on health equity without wading through health inequity. But I would submit that that's the only way we're going to get to equity. So let me give you, there are tons of memes out there, as always, and I want to just highlight this one for a couple of reasons. First of all, in our inequality, we kind of get, right? It's unequal access to opportunities. We're all up under the tree. We're hungry. Let's go to the apple tree. Well, we're up under the apple tree, but somehow or another, there's an inequality there. And so what do? We design a program. That's what the ladders are. Yes, here's the program. Here's the response. But, you know, we're intellectual and we're academic and we're quality practitioners. And we're also caught up in the belief that we have to treat everybody the same. And we have this whole thing the researchers make us attend to, which is fidelity to model. Like, you have to do it the way they said do it. Okay, well, here they are. Same program. Somehow or another, this person's getting overly fed and this person is still hungry. The system, but we don't blame the system. We don't blame the ladder. We still figure out a way to blame the person. Oops, sorry, went too fast there. So then we decide, okay, well, let's have two programs. Let's have the sort of special extra needs kind of a thing. So let's label and brandish all types of stereotypes on a group with this program. So they're able to get apples. Well, kind of they are. But man, I'm up on this ladder, but I got to reach way, way farther. And I might not even be able to reach and attain the apple. Equity are customizing tools that identify the systems, but they aren't in and of itself the complete answer. The issue is that tree, which is the system. It's going to always be problematic until we fix the system. And our systems in the United States were designed through racialized lens. When we say things that, we hold these truths to be self-evident, that all men are created equal, we really, the founding fathers, were talking about themselves. They were talking about white men. So all white men are created equally. But I don't know what to say about women, and I don't know what to say about y'all Black and brown folk. The system is the problem. Now, it's much easier to redesign a program, to change the ladder. But we are the generation, we are the team of professionals to whom is now required changing the system, recognizing that the system was never ever designed to do what we are trying to get it to do. So how do we ask, again, saying the right thing, right? We've got the vocabulary, we've got this worldview. Let me offer just to you a couple of questions to think about. And these are going to start with public health frame. Simple public health question that we ask all the time. Why do people smoke? Smoking cessation, this is really important. Well, we're arguing from an equity perspective and an anti-racist perspective that instead of only asking why do people smoke, that maybe we should also ask, well, what are the social conditions and the economic policies that predispose people to the stress that encourages smoking? Every simple question has a deeper, systemic-oriented corollary that's going to prompt systems change. And so I want to challenge you to start thinking more deeply. You might not have the answer, but you won't get the right answer if you're not asking the right question. How do we connect isolated individuals to social supports? Well, what are the institutional policies that maintain and counteract people's isolation from social support? You might be aware that people that have a felony offense on their record in some spaces are ineligible for public housing. Well, the likelihood that the family is in public housing, having lost one adult contributor of that household income, is pretty high. But when they come out of the correctional facility, it's illegal for them to live with their family. That is a policy that maintains isolation, disrupts family structure. Common question I've heard you all ask in this field, what can we do? How can we increase diversity within foster care families? We need more diverse foster care families. I've had people come talk to my church, which is a predominantly African-American church. We're going to talk to you about the opportunity to be a foster family. Well, the deeper question that we perhaps should also be asking is what policy changes and funding investments are needed to enable kinship care in addition to foster care? And how can we use kinship care more equitably in the communities that we serve? So you've got to push through the status quo, right? Those under the blue, and push to the deeper thinking and the upstream thinking for our solutions. Seeing differently, saying differently. Now let's get to the root of the matter, doing differently. I love Jack Dixon. Y'all see I love quotes. It's just, why think of brilliant things to say when there are so many brilliant things already out there? But Jack Dixon says, if you focus on results, you will never change. If you focus on change, you will get results. We have to change and shift our perspective. So let's talk a little bit more about system change. I'm actually going to click this up because I want to make sure we have some time for dialogue. This is sort of the custom pattern right? Social structure, well, let's go from the bottom, right? How do we, what's the cause of the inequity in the distribution of disease, illness, well-being, and the distribution of child welfare services and the demographics of who's served, the disproportionate representation, all of those questions, right? Well, if we go up, we talk about, well, it's unhealthy behaviors, unhealthy choices, right? People are making bad choices, and psychological stress. Well, why do they, what's the cause of the unhealthy behavior and the stress? Well, then we look at social determinants of health that everybody's talking about now, things like housing, things like school and education, things like employment, things like social networks, those types of things. Well, why is there such a disparity across those social determinants of not just health, but social determinants of health inequity? Well, because there are power and wealth imbalances in our society. There are policies around tax law, policies like I just described around housing, policies around education base. That is why we begin to see some of those different, well, why are those power and wealth imbalances in existence? Well, there is a social structure in our society that we describe, and my sociologist lens comes into this, as being really steeped in racism, classism, and gender oppression. Lots of other identities are also othered and oppressed, but we look at those as sort of the big rocks that have sort of taught us, I'll say, how to oppress. So when we see a problem, we just keep, in public health, we have a quality improvement strategy called the 5 whys. So you just keep saying, but why? And that'll get you a little bit farther upstream. Well, why is that? Well, why is that? So all of you all who were the elementary school kids who kept saying why, or whose parents said, don't ask me why not one more time, here's your chance to be the most powerful change agent through an equity lens. And so this is, despite all of the research and all of the policymakers, they still, we know that those upstream root causes are critical, but we still focus on the remedial, the programs. Oh, let's deal with the psychological stress, not the cause of the psychological stress. Let's deal with the fact that so many Black and brown kids are in the system and we have mostly white foster care families. Let's deal with getting more Black families instead of dealing with the causes of the causes. And this is where we're trying to push people to challenge that why by simply asking why. Why isn't there an arrow going up to social structures, going up to power and wealth imbalances? That is the change that we have to begin to see. So let me offer just a few things for you to think about, just a few statements in doing differently. So first of all, we have to recognize that treating the consequences of inequity through programs and services alone will never eliminate health inequity. It will keep us all employed. It will keep our kids and our grandkids employed. There is a both and. We're in the era now where we, yes, have to do programs and we have to do systems change. We're challenging people to just mandate a re-examination of our priorities, our practices, and our uses of resources. Yes, somebody's job might go away, but guess what? Maybe they can get employed in this other renewed, refreshed role of systems change. We also challenge people that communicating facts about the forces that produce and undermine health and well-being, we've got to begin to push that. We've got to communicate this both to the families we're serving, our constituents, public institutions, political leaders. It is a political challenge. It is an issue around the distribution and allocation of scarce resources. But what it doesn't have to be is a partisan issue. We've lost, again, this issue of civility and rationalizing and justifying and discussing and thinking through together. Come, let us reason together. Let's argue the matter out because of the partisanship. And so much of our work is governmental. Another couple of ones. we, in order to do differently, want to see people developing a policy agenda for equity and social justice, and identifying strategic activities, not in a conference room by themselves, but with the constituencies that we're serving. I would dare say that if the American Red Cross had members of the community in that conference room when they designed the poster, that somebody would have said, why are all the bad behaviors being done by the Black kids? They would have seen it because the poster was about them. The policy agenda is about the constituents that we're serving, involve them in the decision making. And lastly, how do we engage broadly the community involved in the system and not, to develop their capacity and their resources to participate fully in social and political processes. We need everybody up to bat for change to happen. So I want to just invite you to consider some intentionality here. We talk about levels where oppression happens, also being levels where change can happen. So change can happen at the personal level if you challenge your own assumptions. Change can happen at the interpersonal level when we trust that people make decisions based on what they understand to be what's in their best interest for themselves and for their family. It's not father knows best, big brother, society. Trust that people know what's in their best interest. At the institutional level, we challenge people to understand that the choices people make are determined by the choices people have. So our job is broadening the choice spectrum, not narrowing it. And lastly, how do we create systems that promote shared power, that we're doing the work with people and not doing the work to people? That's a cultural value and an institutional norm. So when you are faced with a problem, with a practice in your office or across your discipline, think about it from that personal level, from the interpersonal level, institutional, and the cultural level. I remember being the recipient of a racial slur as a joke in a crowd of, well, it was a group of about 6 people. Didn't get an apology, even when I said, that's offensive. I really resent your saying that. And so speaking later to our supervisor, the supervisor's decision then was to have that person email me an apology. Real problematic, because we took a interpersonal insult and we used a personal solution, one-on-one to me. And it really was an institutional insult because it was happening around other colleagues. So for them to not see any consequence, the message then is, okay, I guess we can get away with that. But then to just bring the solution to a completely different level is going to be ineffective. So you want to think about where's the source of the problem and how are you consistent in the change that comes to play. So a couple of last things. Oh my gosh, I'm running out of time. I got really irritated with what I was calling cowardly leaders. Like, why are people not stepping up? What is the deal? So I started looking into courage and risk-taking. And I came across the work of Margie Worrell. And she very simply, in a Forbes magazine article, gave 4 reasons why people don't take risks. I want to share those with you. One is, she says that we overestimate the likelihood, the probability that something's going to go wrong. If I step into this, if I speak up at the meeting, if I argue that this policy is not anti-racist, is really stereotypical, something terrible is going to go wrong. The likelihood is not that it's not. You know, you're just like, I'm going to be the 1 in a zillion person that the bungee cord's going to break, so I'm not going to take the risk. The other thing that she says is that we exaggerate the consequences of what will happen if it does go wrong. Okay, it may go wrong. The elephant may really fall off the tight wire rope, but there also may be a lake underneath. There may be a big mattress. we overestimate what will go wrong. The third reason she says people don't take risks is that we underestimate our ability to handle it. Having conversations around race and class and gender and racism and oppression, particularly in this day and age, requires taking risks. And it may go bad, but you can handle it. Don't underestimate your ability to do so. And I think most importantly, Warrell says the fourth reason why we don't take risks is that we discount the impact of inaction. Think about the quality of the lives of the children and the families you're serving if you do nothing to change the system in which they are being served. So take some risks. I'm actually going to jump through these because I really want us to get to some Q&A or question and dialogue. You're going to get these slides, and so you can kind of you'll take a look at those a little bit more closely. But my grandmother used to say, everybody grinning ain't tickled. And by that, she would say, Renee, honey, think you basically don't believe everything that just, and I would say to you, everybody saying equity and anti-racism don't mean it. So be discerning. The fairness oxymoron, I kind of hinted at this. We always say that the fairest thing is to treat people the same. I argue that the most unfair thing that you can do is to treat people the same because we're not the same. This is about not intent. It doesn't matter whether you meant to be racist or offensive. The responsibility is the impact. What impact did my words have? It's uncomfortable. Get used to being uncomfortable. Both and thinking. We're trying to, as I said, embrace and broaden the table, not say, think about it this way, this is the only way. There's lots of things. And in that, it's okay to disagree, but we've got to get away from shaming and blaming and attacking. That's all we see in the news now, because it's campaigning season. And I would challenge you to expect that people don't trust you. Here I am, I'm the government, trust me, or whatever that little saying is. Expect distrust and earn trust. And let me just close off the quote that I began with, because Martin Luther King, yes, said all those things about the audacity, but one day I continued reading on that quote, and he continues to say, I have the audacity to believe these things, but I also believe that what self-centered people, he said men, have torn down, that people other-centered can build up. And I have the audacity to believe that you are those other-centered people. And I'm so honored to throw down a gauntlet, and I can see so many of you picking it up with courage. Thank you all so very much, so very much.
Thank you, Dr. Canady. This is Susan Dreyfus, and that was just awesome. And welcome to everyone that's on this chat. I think we're all feeling inspired and challenged, and that's a very good thing, as together this wonderful network of Prevent Child Abuse America visions that next 50 years of your audacity. And what will history say about our leadership over the next 50 years of such a phenomenal organization? Dr. Canady, you're with an amazing group of people here. You've got, you know, within this network, Healthy Families America, a clear evidence-based model be replicated across this country. You have people here from Children's Trust Funds and who are local partners of Prevent Child Abuse America. And one of the things that I love that you talked about is it's not about either or thinking of programs or systems change. It's both and. We need to ensure the equitability of our programs and services, but we also cannot rest until we have changed the systems and gotten at the true inequalities that rest within the systems. And I think for many of us coming through the pandemic, I don't know, as a nation, and at least in my generation, I've seen such a spotlight on how the pandemic unequally affected people, especially people of color, people in poverty, but also how interdependent we are on one another, and that lens on these social and environmental determinants of health. So I've got to believe that when you talked about I love the slide you had about how we need to do things differently. And all I could do was think about PCA and you know, the kind of strategy going forward that in terms of what we might need to be doing differently. So how might, from your perspective, a network, because you work with so many groups and organizations, you know, around the country and see so much going on, how might Prevent Child Abuse in America, with this amazing network, in both the work they are doing locally and the work we are doing collectively at a national level, how do you think we could have greater influence to create a more equitable and just policy agenda in this nation?
Mhm.
And so when you think about networks coming together to truly drive the kind of systemic change we want to see, and knowing you've got a local network, beautiful network here that pulls together into this great national network of voices and influence, what guidance would you give us?
Yeah, I love that question, Susan, and it tie bars to a question in the chat about how do you mandate? Right? How do you mandate change? Well, you know, it does begin with those first sort of early discussions and conversations. Think about, where are your spheres of influence? You have them. I started out being the excuse me, but person in the room. Excuse me, I really appreciate, you know, you got to affirm people because otherwise they shut down on you. I really appreciate. Have we ever thought about why, you know, Black kids are disproportionate? Have we ever thought about what's the biggest barrier for those moms? And the more I think it's 100 and some of you all on this, right? 104 of y'all here. The more 104 people in different spaces take courage from each other to start saying, I'm gonna be the why, then the shift in the field begins to happen. Then somebody else in that room, you might not have the answer, right? Remember, I'm saying you're just starting the dialogue. Then someone's going to say, you know what? In the next meeting, gosh, that's so funny because Adriana Salas said the same thing. If I can use you, Adriana. I was in a meeting when she said the same. You know what? That is so odd, because Christina Massey said that same thing last week. The more we become the echo from the mountaintop, the more people begin to listen and say, okay, well, maybe I should listen and learn a little bit more about that. Ultimately, our desire, we're drawn to this work. This is passion work. This is mission work. This is not like become a billionaire like Michael Jordan work, right? We're in it because of the mission and the passion. And the more we push, the more people are going to say, I never thought about that. I always give the example, one quick last thing, of Lillian Walt, who's one of my favorite leaders, who in the 1800s was considered was born in the 1800s, the early 1900s, was considered the founder of public health nursing. She just said, why do we keep causing moms to come back to the clinic? She was working in inner city tenement housing of Harlem, New York. Why are we making these moms struggle through with these little babies to get back? Why wouldn't we just go see them? Oh, we don't do that. Well, we didn't do it until we did. So much of your work is tied to home visiting. We didn't do home visiting until we did. That took somebody courageously saying, I don't think that's right. I'm going to care about others a little bit more than being worried about the consequence on me. And I've been in many spaces where we'd be in meetings and people are like, go ahead, Renee. I know you have something different. I do have something different to say. Thank you.
Let me ask a lead-on question. And I think all of us we've all been on this journey toward the desire by policymakers for evidence-based practices, evidence-based programming, right? And we created a clearinghouse, and now we've got under the Families First Title 4E, where that eligibility is determined on whether or not the program that you're going to be implementing is in the clearinghouse. But clearly, the question we have to ask ourselves is about the potential for the implicit bias of these programs as they have been defined through evidence, right? And how do we, as leaders, not just followers, challenged us, and even in ourselves, that what we believe is the evidence may indeed have systemic racism and inequity all over it, and we're just not seeing it because it's quote unquote in the clearinghouse and it's an evidence-based model, and that's what the funding is requiring us to use.
Yeah, I think we go through these eras where, okay, the clearinghouse is being built, right? They weren't in the clearinghouse until they were. The more we then begin saying, can I just ask you about ABC intervention? Here's what we found. Is anybody else having this challenge? And then say to folks, well, we're actually, you've given us the choice to use 4 programs in these funding. We're not using these anymore because of XYZ. We're going to now start using these because of QRS. So just making, you do as leaders have choices. And I really believe that you're farther beyond the excuse me, but I really think you've already got people whose ears are attuned. They're just not courageous enough to say the thing because they don't want to be, I haven't done my implicit bias work. I don't want to offend anybody. Well, risk offending someone. The best way to get over offending someone is to say, I'm sorry that I offended you. Not I'm sorry if I offended you. I was doing a talk last week and someone said, I tried to do this with my colleagues. This group, interestingly enough, was an older white demographic. And she said, I tried. And then people, they just said, well, I feel like you're calling me a racist. I don't want to talk about this. And I said to her, were you calling them a racist? Well, no. Perhaps just clarify. No. I'm not calling you a racist. I'm having this conversation with you because I know you're not a racist, or because I know you've dealt with your biases, or I know you're on the journey with me. If we don't stand up and do something together, who is going to do something?
One of the things that you challenged us with is to have the facts, have the data. And I'm wondering how an organization like Prevent Child Abuse America, because again, I just think it's a beautiful network of change agents, people so dedicated to such a cause. How do we start influencing research itself? How do we create a national research agenda that is an equitable research agenda that would start to counteract, right? Being able to position ourselves to have greater influence on the inequity of research-based programs and what we're today thinking is evidence.
Mm-hmm. I love that. As a former researcher, I spent 16 years at Michigan State University. Let me offer to you that the data is not the problem. It is the questions we are asking of the data. So push your colleagues, and definitely universities, they have a culture, they have priorities. The ivory tower is a thing. Junior faculty definitely don't have as much power, but junior faculty are also trying to do the new and innovative thing. So if you find a scholar that's trying to be an applied researcher, connect with them. Yeah, no, you have that data set, but have we ever thought about this interaction? Like, this is true of Black moms, but what about Black moms who live in this part of town? Or, start manipulating the questions and analyze the data differently. That's where we get different solutions to then help us develop more equitable programs.
Well, I think that's beautiful. And I could actually see PCA and its network creating what those questions ought to be, that we're all going to consistently be using in our daily walk and practice, and also at a national level. I think that's great if we have the discipline of asking the right questions of the data that we're seeing. I've always thought that just any way you take data that generates the why questions, right, helps you really start unpeeling the onion of what's really underneath and being proximate.
Absolutely.
Right, to the work.
I talk often. I appreciate practice-based evidence is a thing, but I would argue to you that evidence-based practice-based evidence is as important as evidence-based practice, if I said that right. So researchers are designing evidence-based practice. I'm arguing that as scholars, they need to think about practice-based evidence. You all that are doing that are the practitioners on the ground, in the field, touching the lives, practice-based evidence is going to be much more legitimate to the solutions than evidence-based practice. I'm in the ivory tower. I've analyzed this data, so now y'all go do it and run with it. No, I'm in the field and I've had these experiences. So in your next survey, you should be asking about these variables. Nobody's asking about this.
I love that. And lastly, I want to talk to you about shared power and then see if Jennifer, if there's any question, last question from the chat we want to go in. I've been trying to monitor the chat too. Is shared power. Beautifully said, sometimes harder to do, right? And yet I think Prevent Child Abuse America, especially because Healthy Families America, you know, it's just so anchors family at the center. That how do you have examples of, or how organizations, because there's, I don't want to overstate, but there's risk in this too, right?
Mm-hmm.
When you authentically share power, but where PCA America could view that the voices of family are equal to the voices of our network and of the professionals, right? It's not an either or maybe randomly every once in a while we do a survey and get input, blah, 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 blah. But when you think about some of the ways that you see organizations authentically share power,
Mm-hmm.
you have just a few takeaways of the kind of shift that's happening.
Absolutely. So you have to remember that power, and I really got comfortable with power by partnering with community organizers. And community organizers are not intimidated by power. And they say that power is simply the ability to affect change or to meet a need. So you have a different type of power than families have. And so it's not about, and I respect that people do much work on empowering families, but from my frame, empowering means that I'm going to be like, oh, here, I'll give you some power. Here, I've got a lot of power. Have some of mine. No, they are already powerful. So co-creating and power sharing is about your power coming together with my power. It's not about, I got some power, I'm gonna give you, all God's children got power. Here, have some power. You get power, you get, Oprah Winfrey or whatnot. It is about me seeing the power of families. And so many of us in our fields are socialized to see our families as less than, quite candidly. They're not as smart as us. Well, they probably are way smarter than you. I bet you couldn't survive living under the challenges and the deficits and the stressors. I know I couldn't. They are way better equipped than we are. And so it's about seeing that power, recognizing that power, and asking, inviting that power. And sometimes that doesn't mean we got our big advisory council and it's 25 of us and we're going to invite one of them. I'm not, if I get invited to the White House and I'm sitting with a whole bunch of cabinet appointees, guess what? I'm gonna be pretty quiet because I don't know these, so stop setting them up to fail. Maybe it's, I also learned this from community organizers, one-on-ones. Maybe it's one-on-ones, we're doing check-ins. Maybe you're learning from them as well as teaching them in your encounters. And you're gathering that information because remember, you are change agents. You're not gathering it to go back to the work site and do the same things the way you did them before.
Well, let me ask Jennifer about any questions in there. I just tell everybody this whole thing about shifting our mental mindset from empowering to the audacity to truly share power, I think is a good takeaway.
Yeah, thank you, Susan. And Dr. Canady, I just sat here the whole time and was like, that you could not have been more perfect for kicking off our inaugural Zooming Out series. So first off, thank you just so much for being here with us and your remarks and your insight and your expertise, everything you shared. I wanted to do one of the reaction emojis every time you said something, but didn't want to get over overzealous there. I just want to be really cognizant that it's 1:03 and I know we were going to end at 1. And so I want to do this. I would love, Dr. Canady, if you have any last remarks you want to share with us, and then I'd love to turn it over to Dr. Merrick and see if she has any closing out comments. And then we can end the session.
No, I would just offer that it's an extremely energizing time to be in the field. We're not doing the work like it's always been done. We are the ones that are going to shift practice, that when your grandkids are social workers or public health professionals or whatever, they're going to be amazed at how differently their jobs are than ours if we succeed. And I know that change happens. So thank you for inviting me. I've appreciated the dialogue.
Thank you so much, Dr. Canady. And we have just, I know, been so filled by more questions and more thoughts, and we're really energized by your comments. I'm also really struck by what you all shared in the chat. We'll be saving the chat. We'll look at these things. All of your insights and perspectives are so important as we, again, chart the course of the next 50 years, the next generation of this work. And we can't do it alone. We need all of you. So thank you, thank you, thank you for all of those of you who attended. We will send out the recording, the slides, everything. I know that was in the chat. Please also join us next month. In September, we are going to really dig into how we use data to identify areas for programmatic, policy, and systems level change efforts. So sort of like the part 2, I think we've all now zoomed out. We have a grounding, a shared vocabulary, a shared energy. And now let's get into what are those actions? What are those tools? What are those metrics that we need? So thank you, thank you, thank you. If you have any other questions or comments or things to share, please send it to Jen or to me or to whomever. We are so thankful for all of you. The way that you do the work that you do is really incredible. Thank you again, Dr. Canady, just for kicking us off in the best way possible. Thanks, everyone, and see you soon.